So I just got this email in here from, well, someone, and it says that Governor Fallon of Oklahoma says no to state-based insurance exchange. Oklahoma Governor Mary Fallon today issued a press release stating that the state of Oklahoma will not pursue the creation of a state-based insurance exchange or participate in the expansion of Medicaid, both part of the PPACA, where the Patient Protection and Affordable Care Act, which is ObamaCare. This appears to be a win for the people of Oklahoma. I guess, I don't know. Kind of confusing, actually. The exchanges are the cornerstone of the Affordable Care Act and will tie into the other exchange, namely the Health Information Exchange. Expanding Medicaid coverage to more people, to 133, right, of 3% of FPL will break the bank. We cannot afford it. Now, let me see here. Here's what she said. For the past few months, my staff and I have worked with other lawmakers, Oklahoma stakeholders, and healthcare experts across the country to determine the best course of action for Oklahoma in regards to both the creation of a health insurance exchange and the expansion of Medicaid under the Affordable Care Act. Our priority has been to ascertain what can be done to increase quality and access to health care, contain costs, and do so without placing an undue burden on taxpayers or the state. As I have stated many times before, it is my firm belief that Obamacare fails to further these goals and will in fact decrease the quality of healthcare across the United States while contributing to the nation's growing deficit crisis. Despite my ongoing opposition to the federal healthcare law, the state of Oklahoma is legally obligated to either build an exchange that is PPACA compliant and approved by the Obama administration, or to default to an exchange run by the federal government. This choice has been forced on the people of Oklahoma by the Obama administration in spite of the fact that voters have overwhelmingly expressed their opposition to the federal health care law through their support of State Question 756, a constitutional amendment prohibiting the implementation of key components of PPACA. After careful consideration, I have informed U.S. Secretary of Health Kathleen Sebelius that Oklahoma will not pursue the creation of its own health insurance exchange. Any exchange that is PPACA compliant will necessarily be, quote, state-run and in name only and would require Oklahoma resources, staff, and tax dollars to implement. It does not benefit Oklahoma taxpayers to actively support and fund a new government program that will ultimately be under the control of the federal government, that is opposed by a clear majority of Oklahomans, and that will further the implementation of a law that threatens to erode both the quality of American health care and the fiscal stability of the nation. Furthermore, I have decided that Oklahoma will not be participating in the Obama administration's proposed expansion of Medicaid. Such an expansion would be unaffordable, costing the state of Oklahoma up to $475 million between now and 2020, with escalating annual expenses in subsequent years. It would also further Oklahoma's reliance on federal money that may or may not be available in the future given the dire fiscal problems facing the federal government. On a state level, massive new costs associated with Medicaid expansion would require cuts to important government priorities such as education and public safety. Furthermore, the proposed Medicaid expansion offers no meaningful reform to a massive entitlement program already contributing to the out-of-control spending of the federal government. Moving forward, the state of Oklahoma will pursue two actions simultaneously. The first will be to continue our support for Oklahoma Attorney General Scott Pruitt's ongoing legal challenge of the healthcare law. Our second and equally important task will be to pursue state-based solutions that improve health outcomes and contain costs for Oklahoma families. Now that's all the time I really have to read for this. I guess I'll try to put the link below to this, but so it's kind of interesting. I guess you could kind of sort of call it a version of nullification, but it's not fully. I mean, I don't understand why they don't just read Nullification by Tom Woods and do it. If you just nullify it, just that's all we have to do. I mean, maybe you have more information. Some of you have more information on nullification. I'd be interested to hear about it. Oh, so that's pretty much it. Looks like Oklahoma's kind of trying to figure their way around it. We'll see. See ya.